Hello, thanks for watching THV 11 News at noon. I'm Michael Aaron in for Amanda Yeager. Governor Asa Hutchinson's new COVID-19 state of emergency declaration will stay in effect for the next 60 days. Arkansas lawmakers met this morning to discuss the declaration, which he announced last week. Under a new law passed earlier this year, the House and the Senate can decide to end a state of emergency issued by the governor. Both groups quickly adjourned their meetings this morning, taking no action, but they won't return home just yet. The governor is now expected to call a special session to amend Act 1002. It is the law passed this year banning mask mandates by public entities, including schools. The governor now wants to give school districts the option to require masks. He could announce that during his weekly press conference, which is set for 1:30 this afternoon. You can watch live on THV11.com. This all comes as the state continues to feel the impact of the COVID-19 Delta variant. As of the latest report, more than 1,200 people are battling the virus from an Arkansas hospital. That comes after a 24-hour jump of 81 hospitalizations. That is the highest one-day jump we've seen since the start of the pandemic. And the governor says nearly all of those hospitalized patients are unvaccinated. We also saw a significant jump in our death toll over the last 24 hours. 42 more Arkansans have died from complications of COVID-19. That brings the state's total to 6,199. As for our new cases, 844 were reported yesterday. After seeing a dip in COVID-19 testing at the end of March, the pace has picked up over the last few weeks. This was the scene at a UAMS testing site yesterday. That line of cars you see there started to form before the testing site opened at 8 a.m. and it stayed that way through much of the day. It's a trend health officials say they've been seeing for the last several weeks.
I think people are just anxious, again, because they may have been exposed to somebody and now they have symptoms, and that's really what I'm seeing a lot of.
The people coming through the line range in age and vaccination status. The Arkansas Department of Health and Little Rock Pediatric Clinic also tell us that they are seeing a similar increase in that COVID-19 testing. The Delta variant of the coronavirus has made it clear that this pandemic is not over, and it's prompted new concerns and the return of mask mandates in some areas. But why is it more contagious than the other mutations? Jerry Carnes explains.
The coronavirus has been studying and learning about our bodies. It is the ultimate problem student. The Delta variant has learned better ways to multiply and spread.
At least twice as infectious, maybe even a little bit more.
The majority of new infections in the United States are due to the Delta variant, the most concerning mutation so far. Let's explore why it spreads better and faster than other variants of the coronavirus. To survive, viruses have to multiply. First, they have to attach to our cells. The spike protein on the coronavirus is like a key that helps it latch onto our cells, then unlocks a door allowing it inside to multiply. Dr. John Brooks of the CDC says the Delta variant has developed a more effective key.
That means that the amount of virus in your body, or what we call the viral load, can go up fast and much higher. The more virus in your body, the more you have to share.
A study of cases in China concluded the Delta variant produced 1,000 times more virus than earlier versions. Dr. Brooks says if given the chance, the coronavirus will continue to learn and mutate.
And there is always the very concerning risk that not only will it learn to replicate faster and move through the population faster, but do even worse things. We have to get people vaccinated to cut this virus off at the knees. We can't keep giving it a chance to evolve.
The CDC lists 10 variants of the coronavirus. The Delta variant is one of 4 that all spread faster than the original version.
Now to some developing news this afternoon. An investigation into New York Governor Andrew Cuomo finds that he sexually harassed a number of current and former state government employees. The investigation conducted by 2 outside law firms found that the Cuomo administration was, quote, a hostile work environment and that it was, quote, rife with fear and intimidation. Cuomo is addressing the investigation right now. We'll have an update tonight on THV 11 News at 5 and 6, and you can stay with us online as well for the very latest. Let's take a live look at a sight we have not seen in several months. The I-40 bridge that connects Arkansas and Tennessee is back open in both directions. In case you missed it, westbound lanes reopened yesterday afternoon, days ahead of schedule. This is the first time the bridge has been fully open since May 11th. All right, let's switch gears here for a minute. Take a first look at the forecast with meteorologist Nathan Scott. Nathan, they put you out there on a pretty nice day in the weather garden.
I'm not mad about being out here in the THV 11 weather garden, Michael. It's beautiful. We've got lots of sun, although the skies are hazy, and that's just because we've got the wildfire smoke still moving into the natural state high up above the surface, and that's filtering out the sun somewhat. Temperatures this morning did not drop down to the 60s for many locations, but we do have that expectation going into tonight. Many locations pretty much stayed to the low 70s. That's because we had some clouds around the region, but that less humid air, that cooler air continues to filter its way in here from the north and northeast. Temperatures right now very pleasant with lots of sun. Here are the numbers. Low 80s across most of Arkansas, even 77 in Harrison. You cannot complain about that for our August 3rd. Here's the radar loop. It's all quiet right now, but there will be the potential. You could see a stray shower that pops up for locations primarily to the west and south of Little Rock Metro. Most of us will stay dry. Your forecast today, expecting that mixture of sun and clouds. Temperatures warming up into the mid, possibly upper 80s. This nice weather sticks around for the next several days. I'll let you know when the heat and humidity will be returning coming up.
Okay, Nathan, we'll see in a few. New at noon, Arkansas manufacturer Tyson Foods will require all of its U.S. workers be vaccinated against COVID by this fall. Almost half of the company's 120,000 employees have already gotten their shot, but Tyson says it wants to do more. Employees at U.S. offices must be fully vaccinated by October 1st. All other workers are required to be fully vaccinated by November 1st. As COVID cases surge and the Delta variant spreads, more Arkansans are deciding to roll up their sleeve. Pharmacists across the state are reporting a big increase in people seeking vaccinations. The two pharmacies we spoke to say, unlike before, a lot of the people this time around are younger.
With demographics and the people receiving the shot, I would say the majority are like the 20 to 40-year-old age group.
It's hitting more close to home. I feel like there's a lot of patients that come in and say that they have had a family member affected or somebody that they know is currently hospitalized and on a ventilator.
Cornerstone Pharmacy in North Little Rock tells us they've seen a 200% increase in vaccinations compared to March. And over at Doctor's Orders Pharmacy in Pine Bluff, they're seeing much of the same at a roughly 170% increase. With school set to start in a few weeks, many parents are worried about sending their kids back to the classroom around possibly unmasked and unvaccinated kids. It's even led some to lie about their children's age so they can get the COVID-19 vaccine before they're old enough to even receive it. Michael Wilson takes a closer look at the trend.
While some parents are saying they won't take a chance on getting their kids vaccinated, others are saying they'll do anything to protect their child.
They feel a desperation about school starting.
According to the CDC, kids 11 and under are not eligible to receive the COVID-19 vaccine.
2 of my 3 kids are 12, and so they've been vaccinated, and I have another child who's 9.
Sarah Carrier's 9-year-old is currently unable to get the vaccine, but after a year of virtual learning, the Carriers are sending their 9-year-old back to the classroom.
We're concerned without a mask mandate in place.
The family says they're concerned about being near other unvaccinated children in the classroom as COVID-19 cases continue to surge.
We're just concerned about their kids catching it and then, possibly passing it on to other people.
Carrier says she shares the same fear as many parents.
As a mom, you would just do anything to protect your kids,
but would never lie about her child's age so they can receive the vaccine.
I can see where people are so concerned and so fearful and wanting them to be protected.
But pharmacists are asking parents to wait.
Just for safety reasons and for, immunization record.
Michael Wilson reporting this afternoon. Again, health experts ask parents to wait until their child is eligible for the vaccine. The best and safest thing to do, they say, is wait. While vaccines are widely available across the United States, some people around the world are desperate to get the shot. Because of the slow rollout of vaccines around the world, some people are becoming vaccine tourists, flying to the U.S. to get their shots. Many arriving in San Francisco are getting the Johnson & Johnson one and done. And since May, the airport has vaccinated around 1,000 people from over 50 countries.
we've got a surplus supply, and being able to make that available for others is really a good thing, and it really helps everyone.
Thank you so much.
Nearly 29% of the world's population has received one dose of a COVID vaccine, according to researchers, while roughly 15% is fully vaccinated.